next movement, she already called it out. This is the psoas. Your psoas muscle runs from the inside of the leg at the top of the femur up to the lumbar area. And my fingers are underneath her, posting straight to the spine. I'm on bone underneath her and wiggling her over my hand. This gets the psoas muscle to release, and that will feel almost like an adjustment. So people that have been to a chiropractor, before I was a chiropractor, this is how I'd beat the chiropractors. Is take about 10 minutes and just rock this loose, and it almost equals an adjustment. When you've run a lot or stood a lot or walked a lot, this is a great one to relieve that low back, and it'll just feel like you've stretched out and elongated the vertebrae. I'm going to change sides here.
Where are you putting that hand?
This one?
Yeah.
Right down. So she's asking where my hand is. I'm just to the left side of her spine, right where the muscle is. On somebody of Nancy's size, that muscle's probably that big around, maybe 1.5 inches in diameter. And then I'm going to have you lay on your back. On all three people, I'm going to check one other thing. We sometimes do it if you ask, or if there's some condition that relates to it. Leg length is really important, and it goes this quick. I put equal pressure on her, then I have her sit up and lay back. And have we talked about your leg length ever before? Okay. As a former mechanic, if you pulled into my gas station where I worked and you had half pressure on your right front tire, I'd really want to put some air in it for you before you went on a road trip. For walkers and runners, if you're using both legs, she's about 1 centimeter short on her left leg. When she sits up, she's about 1 centimeter short. That's like Nancy has 2 different shoes on. I get anxious knowing that that's happening. That's my problem. So, in front of everybody, let us help you sometime down the road. If you do, for not just her, but anybody that has a leg length difference, what I do is I send out either for a standing pelvis x-ray or a CT scanogram, which measures the bone. In athletes, I'm more toward the CT scanogram, because when you take the x-ray, you try to hold yourself like picture day, and then it cheats. It doesn't give me a good read. A $6 rubber lift goes into the shoe, and then her legs are level. Dual A-hip, stiffer when sleeping, and present when waking. Better with movement or worse with movement? Okay, go ahead and land your back, same thing, feet right off the edge. I'm going to look at leg lengths first. Go ahead and sit up. Nice and level, right on the button. Go ahead and lay back. Any injuries to it? Okay. I'm going to just do some stretches real quick. Hypermobile left hip. So what's happening is, I know this is like don't mean to have it be like a psychic show. It's just when I moved her leg like this, there's no resistance on this side. So what that means is there's a deactivated gluteal muscle group, and it's allowing too much motion to take place at this joint relative to how everything else moves. That's not uncommon when we have a favorite pattern where as we move, muscles orchestrate, just like in an orchestra, all the instruments play. But I think what's going on for you is you have a deactivated muscle group. So if you can swing by over here, I'll go over how to kind of make that fire. And I think due to time, I'll work with you over here too, and we can post your results for the sake of time. Any questions before I stop on here? Okay, I hope today you can see, I'll put more information online, and Eric is videotaping this. I hope you find us a useful tool. We're here as a resource for you because, as John knows, I'd like to see as many people cross the finish line as signed up to start the program, and anything we can do to help you out here.